Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss osteoporosis and how that can be related to VA disability. So many veterans suffer from osteoporosis. They were potentially diagnosed on active duty or post-service as well. And they can get service connected for osteoporosis as it relates on a primary or direct basis to their service or secondary to another service-connected disability. Either of those can be if it was either caused or aggravated by either their service or another disability incurred in service, right? So what is osteoporosis? So let's talk about what it is to begin with. So I'm going to pull up the Mayo Clinic's definition. So osteoporosis causes bones to become weak and brittle. So brittle that a fall or even a mild stress, such as bending over or coughing, can cause a break. Osteoporosis-related breaks most commonly occur in the hip, wrist, or spine. Bone is living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. Osteoporosis affects men and women of all races, but white and Asian women, especially older women who are past menopause, are at higher risks. Medicines, healthy diet, and weight-bearing exercise can help prevent it. So some of the symptoms are going to be back pain caused by a broken or collapsed bone in the spine, loss of height over time, stooped posture, a bone that breaks more easily than expected. So some of those causes, again, Mayo Clinic discusses this as bones being in a constant state of renewal. New bone is made and old bone is broken down. When you're young, your body makes new bone faster than it breaks down to old bone, and your bone mass increases. After your early 20s, this process slows, and most people reach the peak bone mass by age 30. As people age, bone mass is lost faster than it's created. So some risk factors, again, sex, age, family history, body frame size, hormone levels, so different sex hormones, thyroid problems, other glands. There's dietary factors that can be involved, some medications, medical problems, and this is where some of those secondary service connections are going to come in, right? So celiac disease, inflammatory bowel disease, kidney or liver disease, cancers, multiple myeloma, rheumatoid arthritis, different lifestyle choices, so sedentary lifestyle, excess alcohol consumption, tobacco use. Okay, so we talked about some of the basic building blocks of how we define osteoporosis. So let's talk about how that can be related to a veteran's service. So on a primary or direct basis, somebody may develop osteoporosis in service. They just get diagnosed in service. And that should be pretty straightforward if you were diagnosed in service, if it's continued since service. That should be pretty straightforward in most cases. If you have one of those other medical conditions and post-service you develop osteoporosis, I see this a lot of time with medication use. So one of the most common causes of osteoporosis or things that can be linked to it is proton pump inhibitor use. So like if you have gastric reflux or gastritis or something like that, that is service connected and you're taking a proton pump inhibitor, that can lead to the development of osteoporosis, right? So I have a few articles that I'm going to read off really quick that I use in some of those specific cases that may be helpful to you. If you want to take it to your primary care manager, they may be able to, write a report if this applies to you. So proton pump inhibitors in bone health, an update narrative review published in the International Journal of Molecular Science talks about that PPI use. Another article, the association between prolonged proton pump inhibitor use and bone mineral density, published in Risk Management and Health Policy. Drugs that affect bone metabolism, that's in UpToDate, which is a point of care resource that many medical professionals use. So there's going to be some other medications in there as well, just beside not just the PPI that you can look at. But some of those medical conditions that we talked about, again, I'll list them off that can secondarily cause osteoporosis are that celiac disease, inflammatory bowel disease, kidney or liver disease, different cancers, multiple myeloma, rheumatoid arthritis. So let's talk about the ratings real quick, because I know that you guys like to talk about ratings, and these are always subject to change, and it's important that you follow up with an accredited legal professional if you have questions about this. I always throw that disclaimer out. I am a medical professional. I assist veterans with medical opinions at times, but if you need advice or claim strategy or to go over the specifics of the legal process, you want to reach out to a legal professional like a VSO, accredited claims agent, or an attorney, right? So if your osteoporosis creates incapacitating episodes, you may be eligible for one of these ratings. So 20%. The rating is given to veterans who, with x-ray evidence, experience osteoarthritis in 2 or more major joints or 2 or more minor joint groups with occasional incapacitating exacerbations. And 10%, the 10% rating is given to veterans who, with x-ray evidence, have osteoporosis in 2 or more major joints or 2 or more minor joint groups. Okay. So I hope this was helpful. Again, my list is not all inclusive. There's going to be other, we've talked about this before with smoking and alcohol consumption. Now, smoking itself, you can't just say I smoked in service, so it's the service's fault. But maybe you've developed compensatory coping mechanisms to deal with stress, and that can be a bridge to some of these things if you've got a mental health condition that drives you to smoke or drink or whatever. So please drop some comments if you found this to be helpful, and I will talk to you guys soon. Please like and subscribe. All right, thanks.